Hi, my name is Michelle Embleton, and today we're going to talk about assisted reproduction for same-sex female couples. First, we're going to have a look about having a baby using donated sperm. Then we're going to talk a little bit about the techniques of artificial insemination and in vitro fertilization using donor sperm. Then we're going to talk a little bit about a technique called reciprocal IVF and look a little bit into the details about the legal aspects of that treatment. We'll finish up by asking a couple of our most frequently asked questions that our users have and answer them for you. In a same-sex female couple, we have two potential mums, but we lack the male gamete. So it goes without saying, for a lesbian couple, in order to have a child, they're going to use donated sperm. The donated sperm you use will depend on the country you live in, or possibly the state you live in. In the United States, it is possible to choose your donor. You may want to think having a family member or a friend. Family members may increase the possibility that it genetically and physically resembles you. We also have the possibility of maybe a family friend, someone that you know, becoming the donor. If you use this option, it is important to think about the legal aspects of the donor. So check with legal counselling to make sure that the sperm donor doesn't have parental rights, but the two mums are the ones who are the legal parents and guardians. If other parts of the world, such as the United Kingdom and many parts of Europe, sperm donation is an altruistic, anonymous act. You cannot choose your sperm donor. The sperm donor will be selected by the clinic for you. For artificial insemination or intrauterine insemination, the woman who has chosen to become the mother will have to undergo mild ovarian stimulation. This involves hormonal medication taken by the woman to develop and mature one or two of her eggs. This process will be monitored by ultrasound to check the development, and when these eggs are ready, ovulation will be induced, again, by hormones, often by a hormone shot administered by your doctor. And at a set period after this shot, ovulation will occur and the woman will be ready to undergo the artificial insemination. The donor sperm, given perhaps by a known donor or by an anonymous donor, will be prepared in the laboratory, will be capacitated in the laboratory, and then will be placed via a catheter into the recipient woman's uterus, where hopefully fertilization will take place, followed by implantation. You will then have to undergo the dreaded two-week wait, often known as the beta wait, before you can take the pregnancy test to see if the treatment has been successful or not. The process of artificial insemination is a relatively simple technique. It doesn't require anesthesia and will take place in your doctor's surgery. You can usually go home and carry on a normal life afterwards while you await your pregnancy test. If perhaps you have previously tried artificial insemination and it hasn't worked, or perhaps there are some underlying fertility issues, you may want to go for IVF to try for the baby. In an IVF cycle, the woman who has chosen to be the mother will have to undergo ovarian stimulation with larger hormone doses than for artificial insemination. This is because we need more eggs to mature. You will be given the hormone medication by your doctor, taken according to your instructions, and the development of the eggs will be monitored by ultrasound. When the oocytes, the eggs, are ready, you will undergo what is called follicular puncture. Follicular puncture does take place under mild sedation or mild anesthesia. It's also called ovum pickup, in a simple procedure where your eggs are removed from your ovaries. These eggs will then be taken to the IVF laboratory, where they will undergo the in vitro fertilization. The previously prepared sperm from your donor will then be mixed with the egg cells, either using a technique called ICSI or regular IVF. And the resulting fertilized eggs will then be allowed to develop in the laboratory. These embryos, when they are ready, will then be transferred into the uterus of the woman. The woman will previously have to prepare her endometrium, so more hormonal medication to make sure that the lining of the uterus is ready to receive those embryos. embryo transfer will occur, and hopefully implantation, again, the 2-week wait following the embryo transfer until you can take your pregnancy test to see if the treatment has been successful. When one woman in a lesbian partnership undergoes IVF, you may want both women to sign the consent forms to make sure that they are both included as the legal mothers. In a lesbian partnership, we have 2 sets of ovaries and 2 wombs. So we can do something called reciprocal IVF, in which both women can feel really actively that they participate in the pregnancy. One woman is chosen to provide the eggs, and the other one is chosen to carry the pregnancy. In a reciprocal IVF treatment, the woman who provides the eggs is usually the younger of the 2. This is because egg quality does deteriorate with age. So the younger you are, in theory, the better quality eggs you have. The woman who is the egg donor will undergo ovarian stimulation with hormonal medication so that several eggs develop. When the eggs are ready, they will be collected in ovum pickup, a follicular puncture process, and the eggs taken to the IVF laboratory where they will be fertilized by the donor sperm. In a coordinated fashion, the woman who is going to carry the pregnancy needs to have her uterus prepared. She will also undergo hormonal medication, but a different kind, and this is to make sure that the endometrium becomes prepared and receptive for the embryos. Then, when the embryos and the endometrium are ready, she will undergo the embryo transfer, and hopefully the embryo will implant into her uterus, and followed by the 2-week wait, hopefully a positive pregnancy test. This allows one woman to provide the genetic load for the baby and the other one to carry the baby so that they feel both actively involved in the pregnancy. Well, really, this does depend again on the country or state you live in. In a country such as the United Kingdom or Spain, egg donation is a totally anonymous and altruistic process. So the idea is you can't donate that egg to your partner, you become an egg donor. However, if you're legally married or in some countries have the legal binding relationship to show that, it is allowed. For example, in Spain, if you are a legally married lesbian couple, you can donate your eggs to your partner for reciprocal IVF. However, if you are not married, it's worth looking into legal advice to make sure, otherwise you will not be able to donate your eggs to your partner. In areas of the United States, this donation is freely available. You can choose your egg donor, so there is less problem. However, it is important again to look at the legalities on the forms of who the father is with the donated sperm, who the mother is, to make sure that that baby has both of you as its 2 legal mums. In the UK, the HFEA does state that if the women aren't legally married, but the procedure takes place in a licensed clinic, both women will be recognised as the legal parents. Another legal aspect to think of is if you are undergoing artificial insemination. Many people may think, let's do this at home, let's do a home treatment. If you decide to go through an artificial insemination type of treatment at home and not through a licensed clinic, do be aware that there may be legal aspects involved. Only the birth mother will be considered to be the legal parent. So the other mum may have to look at having to adopt the child. So she is also the legal mother. Now we're going to have a little look at a couple of the most frequently asked questions from our users. Well, in theory, yes. Again, this depends on where you live. If, for example, you are in the United States and using a known sperm donor, this is a lot easier. Providing there is sufficient quantity of donated sperm available, there is no reason why you both can't undergo artificial insemination with the same donor sperm to become mums. If you live in a country where sperm donation is an anonymous and altruistic act, then it will depend entirely on your personal physical characteristics of each woman in the couple. If the 2 women are physically resembling each other and genetically it is possible with compatibilities that are essential, it may be possible the same sperm donor can be used by the clinic, chosen by the clinic, to inseminate both mothers. This also requires sufficient quantity of the same donor sperm to be available. However, if the two mothers don't look like each other, you don't physically resemble each other, especially if you're a mixed race couple, it's not going to be possible to be matched with the same sperm donor. So you will not be able to have the same sperm used at the same time. But there is no reason why you both can't undergo artificial insemination with two separate donors, for example. The National Institute for Health and Care Excellence states that under certain circumstances, donor insemination can be provided by the NHS. Obviously, this is a question for our UK readers. One of the requirements for treatment on the NHS is that a lesbian couple has had at least 6 attempts previously at artificial insemination before they become eligible for treatment. Don't forget that treatment on the NHS does depend on your particular area to area, and also resources are limited and waiting lists can be very long. We would like to hear about your experiences, so please do leave us a comment below. And if you have enjoyed this video and found it informative, please don't forget to click like and subscribe so you don't miss any of our future videos. And I'd like to remind you that in the description below, there's a link where you can read more about this topic. Thank you.